is the Jackson Heart Study cohort, which is the largest and contemporary community-based African American cohort and includes about 5,000 participants. In this African American cohort, the physical activity levels were inversely associated with inflammation marker CRP and coronary artery calcium score, and lower physical activity levels were associated with higher incidence rate of coronary heart disease in long-term follow-up. My name is Daisuke Kamimura. I'm an assistant professor in the Department of Clinical Laboratory of the Yokohama City University Hospital. The name of the article is Physical Activity, Inflammation, Coronary Artery Calcification, and Incident Coronary Heart Disease in African Americans, Insights from the Jackson Heart Study. This article will appear in Mayo Clinic Proceedings. Several previous studies have reported the favorable effects of physical activity on the cardiovascular diseases. Our study was limited in African Americans. However, I think it strengthened the evidence of the good effects of physical activity on the cardiovascular health. And also, this study was performed among African Americans, and only a small number of studies examined the effectiveness of physical activity on the cardiovascular health among African Americans. Thus, our findings extend this evidence to African Americans. The strength of this study is that this study comprehensively examined the relationships between physical activity and inflammation, coronary calcium, and incidence of coronary heart disease in a broadly phenotyped cohort. Inflammation plays an important role in the initiation and progression of atherosclerosis. Coronary calcification is strongly associated with the development of coronary heart disease. The results of this study showed that physical activity was favorably associated with all these aspects, and that increases the credibility of each finding. Based on these, our study provides good evidence to recommend patients habitual physical activity. Only about 20% of African Americans get ideal physical activity, a significantly lower proportion than observed in non-Hispanic whites. African Americans are also at higher risk of cardiovascular diseases, so our results highlight an even greater need for prevention strategies, such as physical activity. Our study results provide strong rationale to increase physical activity, specifically in this population, and also in the other races. Thus, I hope any patient with cardiovascular risk factors, or even without risk factors, consider incorporating the habitual physical activity in their daily lives. Thank you for reading this article.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.